Ms. Lorenzo Baronella reading for John. I am 5'8". Hi, this is John. How can I help?
Hi, John. This is Liz calling from Novartis. I think we've spoken once before. Judy recommended I speak with you about some important information. Are you one of the nurses there?
I am Dr. Barlow's nurse, yes.
Oh, great. I am so glad I got in touch with you. I am calling to share an update that may pertain to some of your patients with chronic kidney disease.
Oh, okay. What is the update?
There is a dosage update for Flexitrab. Are you familiar with Flexitrab? It is a relatively new therapy for patients with chronic kidney disease.
I am somewhat familiar, yes, but that is probably something you should speak to Dr. Barlow about.
Okay, yes, sure. I would love to speak to her. I've been trying to reach her over the phone, and it's been challenging. What advice can you give me? How would you recommend I get in touch with her?
Actually, she just started meeting with reps virtually. Our office manager can schedule that for you. Would you like me to transfer you to the office manager?
Yeah, sure. What is his or her name?
The office manager's Bet.
Okay, great. I will go ahead and try to get that scheduled for her. Before you transfer me, I'd like to ask you, John, do you know if any of your patients with chronic kidney disease are currently being treated with Flexitrap?
Uh,
I want to understand how relevant this dosing update is for your clinical team.
Yes, I think there are at least one or two patients on Flexitrab. I know Dr. Barlow switched for one patient.
Do you think that might have been because there were signs of disease progression?
Yes, I think labs were probably a bit elevated.
Okay, that makes sense. I know our Novartis team has shared with Dr. Barlow some clinical data that shows Flexitrap is recommended in patients who show even subtle signs of disease progression, such as 5% disease in kidney function.
Oh, okay, yeah. When the points are shown to some change in kidney function, we might up the dose of their current med and ask them to come back into the office for a follow up within a month.
When adjusting medications, you always want to monitor your adverse events. As a reminder, the most common IAEs seen with Flexitrab are hyperkalemia at 8%, headache at 10%, and dizziness at 8%.
Yes, of course, we make sure we educate our outpatients on AE management.
That's great that you have taken the time to educate your patients. You had mentioned having your patients follow up in a month. What about those patients who might not do well with their follow up appointments? What if by the time they come back to the office, they've experienced some permanent damage? That can occur. Is little 3 months time right?
Oh yeah, it's absolutely could, but we don't have too much control over that. Oh, Dr. Barlow just stepped out of the room. Do you want me to try to grab her?
Yes, sure.
Thank you very much, folks. Again, I am available January 28th and 29th. I'm aware that I have to travel on my own. Totally fine. My name is Lorenzo Baronella, 5'8". Take care and good luck on your search. Bye.